Well, hello, folks. You're back on the Faculty Factory podcast, and I'm your host, Kim Skorupski. And I'm looking at my colleague and mentor and friend, Dr. Cynthia Rand. Talk to us today about imposter syndrome.
The culture will shape what we think is normative. It will shape what our role models are and whether we think we should be in these positions. But the other thing that plays an important role is a principle in psychology talking about attribution. So the fundamental attribution error, which is sort of a classic of Psych 101, social psych, is that we tend to make dispositional attributions to others and situational attributions to ourselves. So when I'm looking at someone else, I don't have the information about what they're thinking. I don't know their doubts. I don't know necessarily the challenges they have, but I know my own. I know intimately my own insecurities. I know that, I may be anxious when I have to speak, or I know that I may really question my writing ability, or I may feel not at ease with certain tasks that are given me. But I don't see that for other people. So when they appear confident, when I watch someone speak confidently, when I watch somebody lead confidently, I don't have access to that information. So I am more apt to attribute it that they have those skills, they have that confidence. It's really just a limitation of we know ourselves better than we know other people. So what's the solution? How do we overcome that? Again, this to increase the sense of inclusion and the sense of belonging and the sense that this is normal to have doubts and to have to learn new things when you do new things. We need to communicate more about the process and communicate more about the fact that really, when you enter any next step of your career, whether that's taking on your first faculty position out of your fellowship, or taking on a leadership role in a division, or becoming a dean, you're taking on a new portfolio that, of course, you're not competent at. This I actually find for those who are inclined to imposter phenomenon is somehow they believe that one should be fully competent before one takes on these roles. It doesn't work that way. You take on these roles and you become competent, but you have talents, you have energy, you work hard, you have the capacity to do this. So don't misperceive how leadership happens. Leadership and advancement in any career requires taking that leap and learning how to do it. And that is so fundamental. You will acquire greater confidence, you will acquire greater competence as you practice these skills, and you have a community that helps you do that. But no one starts out knowing all of those things. And here's an interesting juxtaposition. So imposter phenomenon, do you know what the opposite of imposter phenomenon is? Ever heard of Dunning-Kruger effect?
No.
Dunning-Kruger is another psychological construct where some of the least competent people are most apt to overrate their own capacities. People who are really competent will really express doubts about the extent of their knowledge because they have enough knowledge to know what they don't know. So Dunning-Kruger is that phenomenon when you get a complete imbecile who thinks they are, absolutely the bee's knees and knows how to do everything.
And that's the Peter principle, right? People rise to the level of incompetence.
When you see Dunning-Kruger effect, you just scratch your head because, lots of studies have just shown that those who rate their ability the highest, again, these are generalizations, but those who rate their ability the highest are far less apt to perform at the level of those who have more self-critical judgment of being able to gauge what their limitations are. So, they're both extremes. Imposter phenomenon and Dunning-Kruger are maybe neither places you want to be, but they do underscore the fact that it's good to recognize what you need to learn. That's okay. It's okay to understand where your strengths are. There's a difference between having confidence and having competence. You can have confidence even when you're still acquiring competence. That is what the process is. of developing as a leader. And as you look around the landscape, as you look around at the leaders that you most admire, remind yourself that they too have had to go through this process. They, as human beings, have had those doubts, still have those doubts, still have that learning process, still have areas where they need to grow and develop.
We have our wonderful guest, Dr. Donna Vogel, my colleague for about 8 years at Hopkins and former program officer at NIH for 25 years, currently a freelancer doing career development and skill building.
Imposter syndrome is very common. People have it to various degrees, some a lot, some a little. Some have it in certain circumstances and not in others. Some people experience it in the professional setting, sometimes in the social setting, but it's that feeling of, I shouldn't be here. Don't you want someone else instead of me? And it takes various forms. It isn't always explicitly said in those exact words, and I want to start off with an example. A few years ago, I was at Hopkins. I was across the street at the public health school, on my way to the annual symposium of what was then called the Women's Health Research Group. And I was on my way to their annual symposium. They have posters, they have talks, they have a keynote, nice event. And I've been asked to lead a lunch table discussion on the imposter phenomenon, where you don't feel like you belong, you're not the right person for the task. And what happened was that I experienced the exact same thing that very morning on my way to the meeting. On my way to the symposium, someone said to me, "Your hair looks great." And of course I said, "Oh no, my hair is a mess." And in fact, I had done my hair and it did look great. We're always doing this to ourselves. In my workshop on how to give a talk, because particularly people who are the most junior person in the room, let's say they're on a job talk, let's say they're a postdoc or a junior faculty member who is interviewing for a job and goes to another university and has to give a seminar, and everybody, or a lot, maybe most, many of the other people in the audience are more senior and more powerful, and they start to feel really inadequate. And what do you do if you've given your talk and it's now the Q&A period and somebody starts asking questions not to you, but to the department chair who happens to be sitting there in the audience, right? What could be more undermining? How do you seize control? You just have to bust back in, but how do you give yourself the confidence to do that? And the answer is, you were invited. You have the mic. You have the podium. Those are your slides. You are the invited speaker. They wanted you here. And that took place before you ever even opened your mouth. So the situation can set itself up for your success in advance. You have to go in knowing that that's the foundation you're standing on before you even begin. But I digress. So I want to get back to what happened at that lunch table conversation. That panel, it wasn't a panel, there was me and then a bunch of other people who chose to sit at that table and what we talked about. And it was an interesting conversation and it was pretty productive. So I saved a few notes about it and what to do when you have that feeling of, I don't belong here. Don't you want somebody else? And number one is, you are not alone. You are not the only person who ever felt this way. Far from it. And feeling isolated, feeling like you're the only person who ever had this problem, is classic in so many situations for making a problem worse. Once you give it a name, once you say, this is what I am experiencing imposter phenomenon. This is a known thing. There is a literature on it. Other people have thought about it and have suggestions for what to do about it. You're well on your way, because it begins to demystify it and takes away its power. Embrace positive feedback. If somebody gives you a compliment, what's your response?
Oh no, now this old dress, or I didn't pay anything for it, or not me, anybody could have done it. Oh, it was easy.
Right, right. And this I get from Weight Watchers. The same thing happens when people try to give you a compliment and say, yeah, you look like you've lost weight. You smile and say thank you. End of story. You don't have to say anything more.
Right. A graceful thank you. Train
Yes.
yourself to say thank you.
Because what happens when you deny a compliment or you deflect a compliment? If someone says something good about your achievements or even about your hair and you deny it, you're really devaluing the person who gave you the compliment.
Right.
You're saying your opinion is incorrect or your opinion doesn't matter. Is that what you really want to say? Do you want to send the message that you don't believe them, that their opinion is worthless? I don't think so. And we don't think about it that way. We don't think about it from the viewpoint of the other person. But if you do, I find it eye-opening. So don't do that. And in a similar vein, don't attribute your success to luck. You know, we all earned this. We worked hard for it. Accept it. Love it. Embrace it. Words can be very powerful. And I've written actually about career language and how it can be diminishing unintentionally. And the same thing happens here. There are a lot of belittling words that we need to just eject from our vocabulary. Things like just, merely,
Only.
right? Just get rid of it. Because whenever you let those little particles sneak into something where you're talking about an accomplishment or a skill or an attribute that you should be proud of, it's diminishing. We can't afford that. We can't do that to ourselves. And one way to keep that in perspective is to keep track. Keep a journal. And I don't mean update your CV. That's another conversation. But just keep a file. It could be a paper file full of letters. It could be a file on your desktop of emails that people have sent that say good things about you. But keep them. Keep a journal or a record or a file of things that you've accomplished, things that your effort made a difference. And don't just tuck it away. Take it out and look at it. Learn from it. Because we all forget stuff. We may forget what we've done well in the past. We need to remind ourselves of those things that really stood out and made a difference. It can be a tremendous boost to your confidence, and because it's a boost to your confidence, it becomes a boost to your ability to go forward. Another point, very simple, abandon perfectionism. Do I need to say anything more?
No.
And the last thing is admit when you need to seek help. It is not a weakness. It is simply being human.
Well, this is great. Can you recap those points for us?
Sure. 1, you're not alone. 2, embrace positive feedback. 3, it's not luck, it's you. 4, eliminate belittling words. 5, keep a journal and look at it of your efforts and achievements. Abandon perfectionism and admit when you need help.
Thanks for tuning in to the Faculty Factory podcast. We are a faculty development community sharing tools to build academic leaders in healthcare. Maybe you want to be interviewed on the podcast? Please visit facultyfactory.org/contact and send me a message there. The Faculty Factory podcast and website is sponsored by the Office of Faculty Affairs at the University of Texas Medical Branch in Galveston, Texas.